What's up, everyone? Welcome to another episode of the Milwaukee Sports Performance Podcast. My name is Michael Falk, and I'll be hosting today's episode. And I am joined by one of our baseball performance physical therapists at Kinetic Sports Medicine, Dr. Jeff Steuck. If you don't know Jeff, he is a legit baseball player, more experienced than me in terms of, I think I played maybe pre-K T-ball. Jeff played for GRB all the way through high school before going on to play Division I baseball at Dayton, and then has translated his love of the game into his rehab and working with many of our high-level baseball athletes. Jeff, thanks for taking a few minutes out of your busy day to come on the podcast and chat some baseball.
Yeah, thanks for having me. It's a great day to do some podcasting with this beautiful weather we're having here.
I know. We can't date the podcast, though. This is going to come out. Who knows? It could be sunny when people are listening.
It's a rainy. That's all they need to know.
For sure. Jeff and I are going to dive into trying to talk about finding the root cause of elbow pain in baseball and not just chasing symptoms, which is something that we see quite a bit. So I guess from your experience, Jeff, what is the traditional approach to treating the elbow, and what are some of the issues with that approach for players, and what type of outcomes do they typically see?
Yeah, so I think the traditional approach that is taken in terms of dealing with any elbow issue is kind of the approach that has been the gold standard for most injuries. And that's really just like rest, ice, compression, elevate, our typical like RICE principle. And this is good, but it can be done much better, right? And so when we actually look at what some of the root causes are, we can actually like make long-lasting changes versus just, I'm going to make your elbow feel better so that you can go try to return to play. And once you return to play, you might deal with it again. If we can actually like assess the player as a whole, look at what is actually contributing to their elbow problems, we can try to make changes that are going to last them a lot longer than just 4 to 6 weeks. And then you go to throw again and your symptoms are back. So I think that's probably what leads, I don't want to say that. I had a thought and then it escaped me. So let me go back there. This approach, while it does like help players feel better, we're not really addressing them as a whole and helping them through that journey. We're really just trying to make them feel better and almost like put a Band-Aid on it. And when they go back and they play and they have pain and they come back to you and they're like, yeah, this didn't work. Well, it's like, then what? What do we do from there? And so we got to really like dig into it.
Yeah, no, I think that makes sense. And I take most of the discovery calls of people that come in. And I feel like it's becoming increasingly rare in baseball players, the older that they get. I had a call 2 days ago with a family that this young man's now is middle high school. He's gone to physical therapy at a different clinic, just more of a traditional setting. 3 consecutive years all with elbow pain. And he's this year able to make it to the end of the summer baseball season, but now I don't know if I'm going to be able to continue playing into travel ball. And so they reached out, because we've tried this and it hasn't worked. So we want to try a different approach, which I think is what you're hitting at.
Yeah. And I do think like we do need to take care of the symptoms. Yeah. But if that's all we're doing them a disservice.
Yeah, no, I agree. That's kind of what I try to tell people. It's like, we're not like savages where it's just, your elbow hurts, just deal with it. We're gonna fix this underlying cause, but you're gonna be miserable while it happens. We can still try to make you feel better, but also look under the hood a little bit deeper. Okay, that's awesome. So then let's talk about maybe some of what are some potential root causes that could be contributing to the elbow pain outside of just my elbow hurts because I threw too much.
Yeah. So lots of times when I start diving into the elbow problem, I'm going to assess the elbow, but the first place I'm looking after that is I'm looking at the shoulder. More times than not, I've seen guys come in who are dealing with elbow pain, and when you assess their shoulder mobility, there's going to be some decreased range of motion there, whether it be overhead flexion, external rotation. Maybe they just have a tight capsule and they can't really get into internal rotation. But more times than not, there's some issue going on there that could potentially be contributing to their elbow. On top of that, if we actually look at what is their thoracic spine doing, from what we know from throwing mechanics, there needs to be some extension in that T-spine as well as rotation to allow that shoulder blade to posteriorly tip, helping us get into more layback. And so if we can't do that, we're limiting how much external rotation we can get right off the bat from there. And so that can also be another major cause to what's going on at the elbow.
Yeah. No, I agree. It's not the way I've explained it to families in the past is it's like the ball is getting back there. If your shoulder's tight or your T-spine gets tight, it's not maybe you're throwing not quite as hard, but typically you're not losing velo right off the bat.
Right.
So the ball is getting back there somehow. And if I know it's not happening through those two areas where it's supposed to be happening, so where is it? I think many times it can be like from gapping the elbow and putting stress on those medial structures and just making them work harder.
Yeah. And from what we know with what we've seen with our throwers, they start dealing with these decreases in shoulder mobility. That's going to lead to that elbow trying to take over, do all the work. And then that in turn leads to weakness at the medial forearm. And so, yes, like it is caused by what's going on at the shoulder. And that's what's leading to this elbow symptoms. And then it's also leading to weakness that's going on in the forearm. So it's a chain reaction, really. Sometimes it's which one causes which, but in this case, it's typically something's going on at the shoulder, the elbow's taking over for it, it's getting sore, it's getting weak. So we got to work on that.
Yeah. No, I think that makes a lot of sense. I think it might be a good time then to dive into how would you know that the forearm is weak and potentially contributing to putting more stress on the passive structures around the elbow because the muscles aren't doing their job.
Yeah. So any thrower that comes in, whether you be a pitcher, position player, two things I like to look at in terms of the elbow is the traditional form of grip strength where we're actually using like a handheld dynamometer. I like using this just because I get a good sense of like, is grip painful? Is it pain-free? But I'm not as concerned with like what the absolute value is, but I can use it as kind of like a screener of like, does this feel okay? Does it not? And from there, I really like using our Flex Pro grip device. This has been an amazing tool that we've got that we can actually like assess individual fingers as well as individual muscles within the forearm that help protect our elbow. So through using that, we've seen a lot of guys coming in with elbow pain that have actually had very low strength numbers in their fingertip and mid-finger flexion strength.
Yeah, no, I agree. I think that device has been eye-opening for us so far. And yeah, I think we're still learning about it, but I've been telling people it's like, yeah, intuitively, I always used to do just normal like squeezing dynamometry. Just how hard could you squeeze this device and measuring that? Because that was the best thing that we had available at the time. The interesting thing was in the research, didn't have a super good correlation or really anything with like baseball performance, injury risks, differences between players that got injured and didn't. And I think we're starting to learn why as the research has gotten better. That particular test involves the thumb a lot, and the thumb doesn't do anything with the elbow. And this new device and the guys behind it are really trying to put some science to it and looking at this new way of being able to focus on some of those muscles that surround the joint. And what I think is really cool about it, and the way back when we started Kinetic, was I like wanted everything that we did testing wise to not just be a toy, but to be actionable. And I think that's what's been cool about this device. Is it's not just assessing it. We're actually able to like train with it too and use it to impact care.
Yeah. No, it's been very great. And I've been a huge fan of it just in terms of like, not even our injured guys, but the guys that are healthy that want to train on it and the progress that they've seen. The ones that were in this past winter training on it consistently, I haven't heard anything in terms of like, yeah, my elbow's sore, my elbow hurts. It hurts when I throw, like not any of them. So I think it bodes well for the device itself, but also just the shift in like focus on how we view grip strength in terms of elbow and throwers. I think if we continue down that path, we're going to help athletes as a whole. and throwers as a whole.
Yeah. No, I agree. I think it's been really cool. Okay, so we got kind of range of motion through the T-spine, shoulder, potentially some forearms, especially specific muscle weakness with the control there. Anything else that you see as being potential like underlying kind of root cause type factors for elbow pain?
Yeah, another one that we can see not as often as decreased shoulder mobility, but what is our posterior chain doing? And what I mean by that is like, what is our bottom half doing in our throwing motion? Because that can often lead to a lot of compensations in our throwing motion, breakdown in mechanics. And that in turn leads to the elbow having to compensate again. So it's another good thing I like to look at. Like, can you do a single leg squat? Can you control it? Can you do a hip hinge? Are you getting into that backside? Like, how are you using your lower half in terms of generating force for the throw? Because if you're not, you're probably going to end up using your arm a little bit more to get some juice on the ball. And what we know about how the body's supposed to move is everything is a chain. We need to move in that chain in order to generate force and be powerful.
Yeah. No, I agree. And I think part of my love, even though I didn't play baseball growing up, how I was always fascinated by throwing all the way from undergrad and just like looking at the motion, because it literally is probably be careful what I'm saying, but I think in my opinion, it's probably the most total body expression of athleticism that we have. Like, it's the fastest human movement ever recorded in a 3D motion lab. You've got to sequence lower body with the pelvis and the trunk and get the rib cage to coordinate with the scapula that delivers the shoulder at the right angle that gets, and it's all got to be timed up at 12,000 degrees per second. And it's just a fascinating, it requires power and mobility. It requires timing and coordination. And I just have always thought I don't want to say it's like the ultimate expression of human movement, but it is really amazing what people are able to do to get a baseball to move as fast as it does.
Oh, for sure. I thought you might say it's not as good as a golf swing, but I'll take it. Love.
We'll give baseball a little bit of love here too. I actually do think, separate thing, but I do think pitching and golf are probably the closest like movements, because there's not a time component. Like, you're not having, like, baseball hitters have to react to the baseball. Like, pitchers and golfers are, I guess there is now a pitch clock, but for the most part, they get to decide the onstart of the movement.
Right.
They're not having to react. But in terms of control and just like dealing with getting the club face in the right angle, getting the release point at the right spot, like, I think there's a lot of getting the ball to do different things based off how you deliver the hand or the club face to the ball. I think there's actually like a ton of similarities.
No, I definitely agree with that point.
Okay, if you're not careful, we're going to turn this into a golf podcast rather than a baseball podcast.
Let's get back on track here.
Okay, you hit at it a little bit, but one of the common things that I hear when a family calls me with elbow pain is often, I want to come in for a 3D throwing analysis because my son's arm, shoulder, elbow, whatever hurts because of his mechanics. What is your take on, you obviously said the lower body matters, but what's your take on how do mechanics impact elbow pain?
So my first question would be, how old are they? Because I think that plays a large role into mechanics. If we take a 12-year-old and compare them to a college athlete and look at how their bodies move, totally different. Some 12-year-olds might be a little bit more advanced in like their overall control, motor control of the body. But as they age and they develop that skill really, and like they get more of that motor control and how the body's supposed to move, they're gonna become much better movers. So my first question would be, like, what age are they at? Are they towards that younger side of development? Are they a little bit older? Now, if they're on the younger side, I wouldn't say I'm quite as concerned with like 3D throwing analysis. I definitely want to watch them move, see how they're moving. But more times than not, for them, it's going to come down to a lack of strength in some area that's contributing to something. When we get to that older population, yes, they're more trained. Could there still be some strength deficits going on there? Probably, but is there a breakdown in that entire kinetic chain that could be causing these symptoms to arise? Absolutely. And so I think it's not worth the time looking and assessing that 12-year-old, how they move, how they throw. But I think there's a lot more low-hanging fruit there with that older college thrower pitcher. I think then we can actually get like a lot more out of it in terms of like, okay, like you're not able to get your pelvis to rotate first to allow your thoracic spine to rotate through. That might be more of a cause versus a 12-year-old who hasn't done any type of strength training, body weight, picked up a weight, anything like that. So does that answer the question?
Yeah, no, and I think that's how I talk to families about it. I think that there's something there. There's certain things that we know from some of the research that's been done at places like ASMI and Driveline and things like that, that there are certain positions that you can get your arm in. There are certain timing elements that if we're late with getting the ball up and things like that, put more stress on your elbow. I always caution that just because there's more stress doesn't mean it's going to get injured. Now, I think there's some questions on, especially at a high level, like what if the pitch is really effective, right? And he's never had an injury history. There's more stress. Is that something we're going to mess with? Maybe not. Does that mean he might be more of a reliever than a 100-pitch starter? Like potentially. I think there's a lot that goes into that. I kind of always talk to families about like the stuff. I don't know how valuable the mechanics are if you're dealing with elbow pain, if we haven't looked at the stuff that you've talked about already. Like what if we do this 3D throwing analysis, but your shoulder is lacking range of motion. So then we detect, oh, the ball is not getting into the right spot at this time. And we're like, oh, we need to work on the mechanics. But what if it was just a range of motion deficit? Or what if, he can't single leg squat well or doesn't shift into his posterior chain? So a lot of times my recommendation is if there's someone that's in pain, is like, let's look at the basics first. If we check all those off and you're still dealing with this pain, now I'm much more suspicious. Hey, is there something mechanically that's just putting a lot of stress on that elbow versus just jumping right to that and saying my elbow hurts because of my mechanics? Build the pyramid. Let's start at the base. And then that's the last thing that we do.
Right. No, I agree with that wholeheartedly. I think it can be a very useful tool, but I don't think it is the end all be all in terms of like treating an elbow or a thrower in general.
Yeah, for sure. I think that's a good way of saying it. It's a component, not a thrower. That's a perfect segue. You should maybe host a podcast, because my next question was going to be, what does like an assessment look like for you? So someone ends up on your schedule, athlete. I know it's going to vary based off age, but let's just say younger high school kid that's coming in. What does an assessment look like to try to get to some of these root causes?
Yeah. So starting from the top, I'm just going to get a history, right? Like I want to know what's been going on. Have they had recent increases or spikes in their throwing velocity? Have they been keeping up with strength training? Outside of that, I'm going to start going into more of their, like, how are they moving, right? So we're going to go through some type of movement screen where we're looking at thoracic extension, flexion, thoracic rotation, as well as just how does their lower body move. So doing things like single leg squats, checking out something like an RDL or hip hinge, like how do you shift your weight back? Can you do that even? And then after that, I'm going to actually get down to the numbers in terms of like, what is your elbow range of motion look like? What does your shoulder range of motion look like? Are there any deficits going on there? Great. Like that kind of helps start building a good picture of what the athlete is capable of at this time. Then where we get into like the nitty gritty is actually like assessing their overall strength. So I like to look at shoulder external rotation, shoulder internal rotation, as well as their scaption strength, which looks at that serratus anterior muscle, which can be very helpful in terms of like, what is our shoulder doing and how stable is our shoulder on our thorax. With those, we kind of have some like known values of where we'd like things to be. And more times than not, going back to the whole an elbow problem is really more of like a shoulder problem. is we're going to find some type of a deficit in terms of where their external to internal rotation strength is. Again, is that the whole picture? No, but it's a component of what's kind of going on. And then after that, I'll typically look at their forearm strength using either the hand grip and for sure the Flex Pro grip, just to get a sense of what their fingertip, mid finger strength is. And if there's like a certain finger that's a little bit weaker than the others, because that too can give us a little bit more insight as to what's going on. And then for some guys, we might even get them on the force plates to jump them to see like, how powerful are you? How explosive is your lower half? Are you able to generate force to the ground? Are you not able to? And that's maybe why your elbow is starting to bother you. And so going through all of those gives us like a more detailed picture at how they are as an athlete versus if I just stuck them on the table, measured their elbow range of motion, said, you have full motion, but it's painful. So we're going to rest.
Yeah. No, I think that makes sense. And it's just, like you said, trying to get to that root cause. And then I always tell people like a lot of where this came from, it's like a lot of it's just research that looks at, test a bunch of pitchers, see who gets hurt. Let's try to make the pitchers look more like the ones that don't get hurt, like over time. And is that the best answer? It's the best that we have right now. And quite frankly, like just looking at it, it's just statistically, elbow injuries are rising, and we can have a whole nother debate on everything that's involved in that. That's would take another hour and a half, but it's just inherently you are at a high risk of developing elbow pain if you throw a baseball hard right now. And the lowest risk profile that we can give you, the better I feel about your chances of not dealing with elbow pain. And that comes back from someone that's dealing with injury. So let's make you look like the people that didn't get hurt in the first place, to the best of our ability.
For sure. And just kind of like going back to that, right? There's no like one cookie cutter approach to like how we take care of somebody. Yeah, there might be some overlap in like just structure of the treatment based on like how they present. But I'm going to try and make them like, I'm going to try and take care of them for what I see and try to get them to that point to like, yeah, let's look like the guys that aren't getting hurt, right? But how I get there with player X versus player Z might be completely different. And so that's where the assessment is really handy, because I have actual like objective data in terms of your shoulder strength, your shoulder range of motion, pretty much like anything we need to take care of them. And I can really use that to kind of map out that journey to get them to look like the non-injured players.
Yeah. No, I think that's perfect. And yeah, we don't sell an online rehab program for elbow pain for that exact reason. It's that unless you can come in our office, unless we can do this measurement, I don't know how to help you. Everything is individualized. I can tell you these are the general steps and these are the things, but it's like you said, based off age, ability level, even velocity. And it's not like we treat kids that aren't. It's not like we treat a kid that throws 76 like differently than a kid that throws 94. Like we follow the same approach, but let's also be realistic. Like those are very different demands in the arm. Like we need to prepare the young athlete that throws 94 for way higher forces than we need to prepare the young man that throws 76. And there's nothing wrong with either one of those, but if we rehabbed them the exact same way, we would be doing one of them a disservice.
Right. For sure.
So, no, I think that's awesome to give people a little bit of insight. Any kind of last piece of advice to either a young baseball player or the family of a baseball player that's maybe dealing with some elbow soreness or elbow pain?
Yeah, I think first and foremost, we might have to take. All right, let me restart that. First and foremost, I would say get it checked out. Right, we can rest, wait a couple weeks, see how symptoms go, and try to go and throw again. But more likely than not, we're going to end up back at the same place we started. And so getting it checked out, getting it assessed by somebody who actually can give you objective data in terms of like what's going on, that's going to help create a plan that's going to set you up long term, not necessarily for the future, because things change as you age. You might get stronger, you might develop more range of motion, less range of motion. Things might need to be adjusted for that. But in terms of how we get you back onto the field and playing and competing, we're going to have you at a better spot than if you just rested. So get it checked out. Yeah, that's all I want to say on that.
No, that's perfect. I think that is really good advice, especially this time of year. We're nearing the end of summer travel ball season. There's usually a little gap here before fall ball practices and then tournaments ramp up. The biggest mistake, and unfortunately we see it every year, is the player that just finished the season, grinded through it, arm was hurting, whether it be shoulder or elbow, and now it's like, great, we got a couple weeks off, I'm just going to take it easy, and I'm going to feel better come the start of fall practice. I can tell you from doing this for the last almost 10 years now, that does not work. When you start throwing, that arm is going to hurt again, more often than not. And unfortunately, at that point, when we see you, now we have limited options because of the timing. We don't have the ability to get you ready for that fall season. So often it results in a lost season. And that's the end of the world. Like, it's always, especially younger players, like we have ample baseball to be played and plenty of time to get ready for the spring. But for certain kids, like, the fall can be a great time to gain experience, work on skills, or get seen in some different tournaments. The earlier that you get it checked out, the longer the runway that we have, the better the chance that we're going to be able to help you compete on some level in the fall. And the longer that we wait to see you, the more it just doesn't give us options. I think I wholeheartedly agree with that. I really appreciate your time today, Jeff. I know it's a busy time, and thanks for taking some time to share insights and your philosophy on working with elbow pain. With the time of the year that we are in, we are offering 50% off evaluations for our baseball players right now. So the way to get that set up is to go to our website, www.kineticsmp.com. That link will be in the show notes. Click on that contact button. You can book a discovery call or submit a form through there, and we can help you get on Dr. Jeff or one of our other baseball PT schedules and dive into what's going on with that shoulder or elbow and see if we can get you some answers and get you feeling better, and so that you're not chasing pain around all season. You can have a long, successful off season this year and hit those goals going into next year. If you resonated with some of the things from this podcast, hopefully we hear from you soon, and we'd love to help you out. So, Jeff, again, thanks for the time, and thanks to everyone for listening, and we'll see you guys on the next episode.
Thanks for having me.